Hello. I would first like to start by thanking you for taking the time out of your day to view my video. I'm currently a graduate student at Excelsior College located in Albany, New York, and I am in the Masters of Public Administration program. Today's presentation will be an organizational evaluation on the United States Department of Health and Human Services. Like most civil servants over the age of 43, I spend a large part of my day taking in the news from the multiple news sources from Good Morning America to Outnumbered in the afternoon to the 5 in the evening with a splash of local news here and there. Because I have now been on earth long enough to realize that my life is heavily impacted by the decisions or indecisions of our political leaders, and I would like to be as informed as I possibly can. As the nation shifts from one crisis to the next, each crisis seems to surround healthcare. It is the go to topic of all media coverage. The topics include the Affordable Care Act, access to care, the disparity in healthcare among African Americans and Hispanics, the drug crisis, the mental health crisis, and last but certainly not least, COVID 19 mixed with a lot of finger pointing and blame shifting. At the center stage of it all is the Department of Health and Human Services. This is why I chose the Department of Health and Human Services to take this opportunity to gain a deeper understanding of the agency behind the media madness that is all things healthcare. But in case you have been living under a rock or you're still young and carefree enough not to be weighed down by the social issues of the world, then don't just take my word for it. I encourage you to just turn on the news, pick up the newspaper, or read some of the current event on the news feed on your mobile device. I guarantee you will see the amount of daily coverage that is dedicated to all things healthcare. The importance of the U.S. Department of Health and Human Services and health policy is on the center stage of the political arena. The United States Department of Health and Human Services is a federal agency that falls under the executive branch. It is headquartered in Washington, D.C., and encompasses hundreds of programs that are intended to address both national and global issues. The department is led by the Secretary of Health and Human Services, who is appointed by the President of the United States and confirmed by Congress. Alex Azar was our last Secretary of Health and Human Services, and he offered his resignation January 20th, 2021, ahead of the inauguration of President Joe Biden. In his resignation, he is quoted as saying, "If I have left this department that I love a better place than I found it, I shall count myself and my tenure a success." The Department of Health and Human Services is a massive agency that spends more than $2 billion a day. I said $2 billion a day. Its operating division consists of Administration for Children and Families, Administration for Community Living, Agency for Health Research and Quality, Agency for Toxic Substance and Disease Registry, Centers for Disease Control and Prevention, Centers for Medicare and Medicaid Services, the Food and Drug Administration, Health Resources and Services Administration, the Indian Health Service, National Institute of Health, and the Substance Abuse Mental Health Administration. The agency also consists of 15 separate administrative divisions that are responsible for carrying out the administrative functions of the agency, such as the Office of the General Counsel and the Office of Civil Rights, along with many others. The administrative division assists with ensuring the agency is executing its mission both legally and efficiently. So there is no doubt that policies that go through this agency go through a marathon of scrutiny, analysis, and examination before ever leaving. The mission and purpose of the Department of Health and Human Services is to enhance the health and well-being of all Americans by providing for effective health and human services and by fostering sound, sustained advances in sciences, underlining medicine, public health, and social services. The agency has 5 strategic goals. Goal 1 is to reform, strengthen, and modernize the nation's healthcare system. Goal 2 is to protect the health of Americans where they live, learn, work, and play. Goal 3 is to strengthen the economic and social well-being of Americans across their lifespan. Goal 4 is to foster sound, sustained advances in the sciences. And Goal 5 is to promote effective and efficient management and stewardship. The United States Department of Health and Human Services was initially under the umbrella of the United States Department of Health, Education, and Welfare, which came into existence in the 1950s. The Eisenhower administration is credited with the creation of the agency as a cabinet department. The Carter administration separated the agencies into the United States Department of Education and then the United States Department of Health and Human Services, thereby narrowing the focus of their programs. The Department of Health and Human Services both has a hint of federalism and a lot of collaboration going on. The federalism is embedded in the function and operation of the Department of Health and Human Services, given the breadth and depth of its responsibilities. Health and Human Services collaborates with other federal departments and agencies. The Department of Health and Human Services has a federal advisory committee that helps facilitate communication between the different departments and agencies and the stakeholders on high priority issues. The federal government has a legal understanding that also exists between tribal governments, which requires a lot of collaboration. They also work hand in hand with state, local, and U.S. territorial governments on funding, and they also provide expertise on programs. They are also partnered with many aspects of the private sector, education institutions. They collaborate with researchers and non-governmental organizations, and they also collaborate with religious institutions. Department of Health and Human Services, like other federal agencies, cross-intersect with other agencies to address some of the same issues. The Department of Health and Human Services is interwoven into the fabric of the national economy, politics, and other matters of national concern. Therefore, this agency is not able to operate in a vacuum because its power is shared between the judicial and legislative branches of government. In a system of both shared and separate power, there is always a constant push and pull that can result in many conflicts of interest and unclear areas of responsibility. And policy and planning. For policy and planning, the department has, under the administrative division, has an office of the Assistant Secretary for Planning and Evaluation. And within that department, there's an Office of Policy and Planning. And within that agency, they are often making decisions that impact policy, but they don't shape policy. There is an increasing political influence from the executive branch over policy decisions, and we definitely saw that in the handling of the pandemic. They were under immense amount of political pressure to find a resolution to the pandemic and a response plan. The Office of Policy and Planning is divided into subdivisions to kind of organize which policies they analyze. So they have one that covers behavioral health, they have one that covers disability and aging policy, they have a separate division that handles health policy, another division that handles human services policy, and a division that handles science and data policy. The secretary and his department heads must maintain their focus on their key issues, whether operations or a new policy initiative. Developing the evidence, completing the research, providing input on reform efforts, and navigating politics, and also managing his staff. It is the highest concern to ensure the effective operation of its departments and its agencies. Public health policies and health policy focuses on the health of everyone and not just individuals. It safeguards the health of citizens from threats to well-being and promotes beneficial health performance and prevention to include disability. The Health and Human Services departments incorporates doctrines in all their programs to include funding and research programs. Health and Human Services policies and programs are guided by scientific methodologies and evidence-based research. Policies are not dictated, politics should not dictate policy. It should not be prioritized higher than the needs of the public. So the needs of the public should always shape policy and not politics. So the first policy area that we're going to cover is behavioral health policy. The Division of Behavioral Health Policy oversees policies that cover, you guessed it, behavioral health. The area of emphasis covers the examination, funding, implementation, structure, and effectiveness of programs targeted towards individuals that are afflicted with mental illness or substance dependency, to include those who are recipients of Medicare and Medicaid. The government at every level has failed with the implementation of effective programs to treat behavioral health dysfunctions, despite evidence-based research that has identified methods to address issues. The implementation of research programs has been hindered by shortfalls in the policy framework, inadequate funding, and ineffective regulations. Recipients of Medicare and Medicaid are plagued by government bureaucracy that makes the system of care unclear. The lack of coordination between federal and state program administrators and provider often results in a system that conflicts with others and is ineffective. Public administrators and policy analysts within Behavioral Health Policy Division need to make better efforts to incorporate federal and local agencies when developing policies to deconflict multiple policies and to improve service outcomes. So here we have identified what this policy division covers and how it covers it and some of its shortcomings. Here are some principles that they should look at whenever they're addressing certain behavioral health policy. Principle one is to view population health as a continuum. If health is framed as a continuum, behavioral health policy should focus on improving health in the broad depth of the population as possible, rather than focusing primarily on finding and treating people with a specific diagnosis. Principle two, focus on affecting ubiquitous influences on health. A population health approach would encourage policymakers to consider interventions that could influence the mental health of whole populations rather than that of people in one small specific subgroup of the population. Principle three, they should consider the trade-off between efficiency and equity. Helping one part of the population by implementing the easiest health policy intervention will certainly boost overall measures of health, but it may fail to assist other parts of the population, often those who are disadvantaged. To choose among potential intervention, policymakers therefore need to consider whether they value efficiency over health equity or vice versa. Principle four would be to evaluate a return on the investment. When policymakers are setting priorities, they should consider another compelling argument for favoring programs that could prevent disease, such as policy that can yield both a good return on the investment in terms of both improved population health and cost savings. Policymakers who want to improve public health should assess programs' potential return on investment as they consider which ones they should implement. So those are a few principles that policymakers can keep in mind when developing behavioral health policy. So next we're going to discuss a health policy that's near and dear to everybody, the Affordable Care Act. The Health Policy Division is the division that oversees the Affordable Care Act. It is a division that provides comprehensive research and analysis that impact public health in every aspect. The department is divided into healthcare, financing, public health services, access and coverage, as well as quality and outcome. This means they are constantly researching and analyzing the Affordable Care Act, also fondly referred to as Obamacare. Targeting clusters of individuals is fast becoming a standard of practice among policy practitioners to sway the public and the voters. In the public sector, administrators can enhance their policy outcomes and garner more support if the agency has a high approval rating among the public. It is even more important to be able to sway the public opinion when executing policies that target social inequality and disparities in healthcare. Targeted policy making in health policy can be tricky because it can be viewed as unfair for not including all members of the public as a whole, the greater good. Administrators can become easily embroiled in political controversy for disenfranchising of an entire group, such as Middle America. Barack Obama cautioned decision makers to implement universal policies that are sensitive to race to combat disparities and circumvent potential hostilities from targeted approaches. Public administrators and policy analysts within the health policy division have to navigate the socio-political aspects of healthcare disparities in partnership with community-based groups to ensure they understand the needs of the minority community. Most legislation that was enacted in health the most impactful legislation enacted in healthcare since Medicare and Medicaid Act of 1965 was the Affordable Care Act. The Supreme Court of the United States has upheld individual mandates but removed penalties for state. And the Tax Reform Act has removed the individual penalties in 2017. So those are some of the major facts about the Affordable Care Act. They have there have been some successes with the Affordable Care Act. It should be noted. It has reduced uninsured from 41.1 million to 27.5 million. 13.6 million Americans became insured. Uninsured adults decreased from 15.3% to 10.1%. Medicaid enrollment increased by 13 million to 74 million. The exchanges have expanded to 9.9 million by 2017. So they have made some excellent strides with this policy. ACA has used 6 approaches to cover the uninsured. They expanded Medicaid eligibility. They imposed an employer mandate to offer health insurance or pay a penalty. They have provided tax credits to small businesses. They have imposed an individual mandate, which, as I said on the previous slide, was removed. They have allowed dependent children up to the age of 26 to remain on their parents' insurance, and they have allowed income-related tax credits. Inadequacies and limitations of the Affordable Care Act makes it unlikely that there will be continued progress in closing the gap of uninsured without some sweeping changes in legislation. which of course will require some bipartisanship on both sides. The next policy area that we're going to cover is the health science and data policy. So the Office of Health Science and Data Policy focuses on health science and data that covers many areas. It is one of those miscellaneous sections of the division that ranges from economics to privacy policy. So this policy division covers a broad spectrum of many things, but we'll just focus on information technology. One area of interest is health information technology. This is an important area given the proliferation and reliance of technology by our society. There must be systems and policies that govern the use of technology in healthcare settings, protect privacy, and address data breaches. The government does not mandate the use of technology, but it does govern its use. So hospitals and healthcare providers don't have to use technology, but if they do, they have to use it within the framework of the health policy and laws. The Department of Health and Human Services is responsible for operating the health information technology and to improve healthcare deliverables. Information technology systems are beneficial to public agencies, insurance company, providers, facilities by providing real-time data and transparency concerning care. Public administrators should develop health information policy with the patient as the center of focus in partnership with healthcare providers. So you can see here where the Department of Health and Human Services have to collaborate with non-government organizations and the private sectors because many healthcare providers and healthcare institutions are private. There are three areas of focus to determine if a policy will be effective. First is the management of complex health conditions. Healthcare technology policies that enhance quality of life by ensuring that there are remedies for patients and improve their economy. Two, increase access to healthcare. Telehealth policy initiative offers services such as health education, remote diagnostic treatment across distances, and personal management of health conditions. The cooperation of governmental agencies and the medical community will ensure the process of developing and distributing health care technology policy more effective and available. Increased synchronization of services will enable the growth of health technology. Second, the third principle is physician support for healthcare technology. One of the most essential components to a successful healthcare policy framework is the support of doctors to implement and monitor health technology. Physicians are important stakeholders in this development, and their buy-in is instrumental. Decision making is challenging, but it must be efficient and transparent. A group of clinicians and policymakers is set out to address this need by generating an adaptable decision-making framework, incorporating multiple criteria decision analysis for healthcare technology. So these are the many references that I use to develop my analysis of the Department of Health and Human Services. And this concludes my presentation.